Hello guys, how are you? I hope so that you will be fine and enjoying good health. Today I have selected a topic on otosclerosis. So let us discuss what it is. Otosclerosis is an abnormal bone growth in the middle ear that causes hearing loss. Alternative names are otospongiosis, hearing loss, or otosclerosis. What are the causes? The exact cause of otosclerosis is unknown. It may be passed down through families. People who have otosclerosis have an abnormal extension of the sponge-like bone growing in the middle ear cavity. This growth prevents the ear bones from vibrating normally in response to sound waves. These vibrations are needed in order for you to hear. Otosclerosis is the most common cause of middle ear hearing loss in young adults. It is typically begins in the early to mid adulthood. It is more common in women than in men, and the condition may affect one or both ears. Risk for this condition includes pregnancy and a family history of hearing loss. White people are more likely to develop this condition than people of other races. What are the symptoms? Symptoms include hearing loss, slow at first but worsens over time, ringing in the affected ear, which is called as tinnitus, and the vertigo or dizziness. And then there are exams and tests are conducted. A hearing test, audiometry, or audiology may help determine the severity of hearing loss. A special imaging test of the head called a temporal bone CT may be used to look for other causes of hearing loss. The treatment of the otosclerosis may slowly get worse, and the condition may not need to be treated until you have more serious hearing problems. Using some medicines such as fluoride, calcium, or vitamin D may help to slow the hearing loss. However, the benefits of these treatments have not yet been proven. A hearing aid may be used to treat the hearing loss, and this will not cure or prevent hearing loss from getting worse, but it may help with symptoms. Surgery can cure or improve conductive hearing loss. Either all or part of one of the small middle ear bones behind the eardrum stapes is removed and replaced with a prosthesis. A total replacement is called as a stapedectomy. Sometimes only part of the stapes is removed and a small hole is made in the bottom of it. This is called as a stapedectomy. Sometimes a laser is used to help with the surgery. What is the outlook or prognosis? Otosclerosis get worse without treatment, and surgery can restore some or all of your hearing loss. Pain and dizziness from surgery go away within a few weeks for most people. To reduce the risk of complications after surgery, do not blow your nose for 2 to 3 weeks after surgery. Avoid people with respiratory or other infections. Avoid bending, lifting, or straining, which may cause dizziness. Avoid loud noises or sudden pressure changes, such as scuba diving, flying, or driving in the mountains until you have healed. If surgery does not work, you may have total hearing loss. Treatment for total hearing loss involves developing skills to cope with deafness and using hearing aids to transmit sounds from the non-hearing ear to the good ear. Possible complications may include complete deafness, abnormal taste in the mouth, or loss of taste to the part of the tongue, temporary or permanent, infection, dizziness, pain, or blood clot in the ear after surgery, or nerve damage. When to contact a medical professional? Contact your healthcare provider if you have hearing loss, you develop fever, ear pain, dizziness, or other symptoms after surgery. People who have otosclerosis have an abnormal extension of a sponge-like bone growing in the middle ear cavity, and this growth prevents the ear bone from vibrating normally in response to sound waves, and these vibrations are needed in order for you to hear. So, otosclerosis is most often caused when one of the bones in the middle ear, the stapes, becomes stuck in place. When this bone is unable to vibrate, sound is unable to travel through the ear, and hearing becomes impaired. Otosclerosis is a condition caused by abnormal bone growth in the middle ear, and this often leads to hearing loss. Some people may also develop dizziness, balance problems, or ringing in the ears, which is called as tinnitus. Otosclerosis treatment include hearing aids and surgery. Otosclerosis is a rare condition that causes hearing loss. It happens when a small bone in your middle ear, usually the one called stapes, gets stuck in place. Most of the time this happens when bone tissue in your middle ear grows around the stapes in a way it shouldn't. And otosclerosis involves an abnormal overgrowth of bone that prevents one of the tiny bones in the middle ear from vibrating like it should, and this limits the transmission of sound to the inner ear, causing conductive hearing loss. Otosclerosis is the most common cause of middle ear hearing loss in young adults. It typically begins in early to mid adulthood. It is more common in women than in men. The condition may affect one or both ears. The two main treatment options for otosclerosis are hearing aids or surgery. Hearing aids work by making the sounds around you louder. They can help you hear easier, but they will not stop your hearing from getting worse. Otosclerosis is diagnosed using tests including hearing test. A person with otosclerosis typically has a hearing loss that affects all frequencies, pitches, and the hearing loss may be conductive or mixed in nature. And the CT scan is being done to check for damage to the cochlear nerve and the labyrinth. Like any surgical procedure, a stapedectomy carries the risk of complications. While the procedure helps about 80% to 90% of people with otosclerosis, it may not be successful in some cases. In rare instances, your hearing may even be worse after surgery. There appear to be three stages of otosclerosis: resorptive otoclastic stages with the signs of inflammation, followed by an osteoblastic stage involving immature bone, followed by mature bone formation. So, can stress cause otosclerosis? Yes, when you are constantly stressed, the body does not receive a clear signal to return to normal like it does when the stress is acute or traumatic. That can lead to serious health problems such as heart disease, high blood pressure, diabetes, and other illnesses. In turn, these diseases can affect your hearing. Usually, otosclerosis is spread to the stapes or sternum, the final link in the middle ear transformer chain. The stapes rest in the small groove. The oval window is in intimate contact with the inner ear fluids. Anything that interferes with its motion results in a conductive hearing impairment. Otosclerosis is categorized into two types: fenestral and retrofenestral or cochlear. MRI findings of otosclerosis are subtle and may be overlooked, especially if MRI is performed as the first line scan. Typical MRI features of the otosclerosis include intermediate T1 signal and post-contrast enhancement in the perilabyrinthine and pericochlear regions. Otosclerosis, also called otosponiosis, is an abnormal bone remodeling in the middle ear in which a normal dense epichondral layer of the bony aortic capsule in the bony labyrinth is replaced by one or more foci of irregularly laid spongy bone and most commonly involves the stapes region. Otosclerosis is caused by both genetic and environmental factors such as viral infection like measles. Ribonucleic acid of the measles virus has been found in stapes foot plates in most patients with otosclerosis. Populations that have been vaccinated against measles had a significant reduction in otosclerosis. Then in otosclerosis, there is progressive absorption and redeposition of bone that starts anterior to the stapes foot plate, fixing the stapes and causing up to a 60 decibel conductive hearing loss. Otosclerosis is a fairly common cause of sudden hearing loss in young women. In most patients, no cause is identified and these are labeled idiopathic SSHL. These are many theories of why SSNHL otherwise occurs, including viral infections, autoimmune, auto-inflammatory, vascular, and genetics. Otosclerosis is not life-threatening condition, so treatment is not required for patients who are able to successfully adapt to the hearing loss. It is important to note that the condition is progressive, so the hearing loss will worsen with time. There is a limit to how bad the hearing will get. So, the abnormal bone from otosclerosis may also injure the inner ear directly by growing against the organs of hearing or balance. Individuals with otosclerosis will often have a combination of both a conductive as well as the inner ear hearing loss. The hallmark of the otosclerosis is the slowly worsening ability to hear. A Brigham and Women's Hospital otolaryngologist will first conduct a thorough medical history examination to rule out other disease and health problems that can cause the symptoms of otosclerosis. The hearing usually starts to return about 1 week after surgery and can improve thereafter. Stapedectomy is successful in restoring hearing in more than 90% of cases, and the gain in hearing is usually permanent. In a small number of cases, there is no improvement in hearing. Generally, it is considered a slowly progressive hearing loss. There are some patients who experience a rather rapidly progressive hearing loss with otosclerosis. Pregnancy can accelerate the otosclerosis process, thus accelerating hearing loss. Possible complications are complete deafness, abnormal taste in the mouth, or loss of taste to the part of the tongue, temporary or permanent infection, dizziness, pain, or clot formation, blood clot formation in the ear after surgery, and nerve damage. Mild hearing loss of 20 to 40 decibels. Moderate hearing loss is hearing loss of 41 to 60 decibels. Severe hearing loss is loss of 61 to 80 decibels. Profound hearing loss or deafness, hearing loss of more than 81 decibels. So, the tumor caused gradual and progressive loss of auditory and vestibular nerve function on one side. Eventually, the tumor grows out in the brain cavity, causing headaches and paralysis. If it is not removed, blindness and death may result. We have put our heads together to create this accessible guide on the subject, so you have the information you need. So, stage 1 is mild hearing loss, stage 2 is moderate hearing loss, stage 3 is moderately severe hearing loss, stage 4 is severe hearing loss, and stage 5 is profound hearing loss. Engaging in physical activity with proper safety precautions can delay or prevent age-related hearing loss or presbycusis, which affects a quarter of adults 65 to 74 and half of those older than 75. Cardiovascular exercise is vital to hearing health as one ages. 80 to 90 decibel difficulties with speech comprehension becomes impossible without amplification, and with profound hearing loss 90 decibel. And 12 tips to improve hearing and prevent hearing loss are: avoid loud noises, keep your ears dry, don't smoke, be cautious with medications, be aware of excessive earwax buildup, avoid cotton swabs and other small objects, take supplements and vitamins for better hearing health, and protect your eyes. Rubbing stimulates the ear nerve endings and will increase blood flow to the area, bringing blood to the head and making you feel more alert and awake. 8 yoga poses for better hearing power may be useful for otosclerosis exercises for preventing otosclerosis in old age. Natural healers also endorse the use of ginkgo biloba extract which come from the leaf of a tree. According to the health line supporters of this type of treatment suggest that taking 60 to 240 milligrams of ginkgo biloba per day can help with tinnitus and other noise associated with hearing loss. Unfortunately, curing a hearing loss naturally is not currently possible. To restore hearing, intervention is generally required. This could be in the form of hearing and aid devices. In some cases, surgical intervention can help restore hearing. Hearing loss can make the brain work harder, forcing it to strain to hear and fill in the gaps. This comes at the expense of other thinking and memory systems. Another possibility: hearing loss causes the aging brain to shrink more quickly. In individuals with complete hearing loss, cortical brain areas that are normally responsible for processing auditory input, such as the primary auditory cortex, Halsch, gyrus, and the secondary auditory cortex, planum temporale, are taken over by the remaining intact senses. While hearing loss can range from mild to profound, there are 4 classifications that all hearing losses fall under. The 4 types of hearing losses are sensory neural, conductive mixed, sensory neural and conductive, and auditory neuropathic spectrum disorder, ANSD. The most common type of hearing loss is sensory neural, and it is a permanent hearing loss that occurs when there is damage to either the tiny hair-like cells of the inner ear, known as stereocilia, or the auditory nerve itself, which prevents or weakens the transfer of nerve signals to the brain. Sensory neural hearing loss can be the result of aging, exposure to loud noise, and injury, disease, certain drugs, or inherited conditions. This type of hearing loss is typically not medically or surgically treatable. However, many people with this type of loss find the hearing aids can be beneficial. So this was all about otosclerosis. I hope so that this topic would be more informative for the audience, and I hope so that if you have liked this video, then kindly share this video with other individuals as well, and kindly subscribe to my channel. and have a wonderful nice day. Thank you for listening this video.